They had him under the warming lamp and the nurses were doing all the things that they have to do right after the birth. I was really happy, but I was a little scared too because he was so tiny, 4 pounds, 5 ounces. But he seemed to be very much a normal baby, except for his size. Then he started getting sores. They took him to the NICU at Northern Light Eastern Maine Medical Center. He had epidermolysis bullosa. Any type of pressure on the skin causes blisters, and if you don't care for the blisters in a certain way, the blister will spread. It's almost like the skin unraveling. That's when we realized that we had more than just a regular infant on our hands.
It was frightening because, we're in our 50s and we both raised children to adulthood. Now we have our grandchild.
It was overwhelming, just the worry, getting used to that routine and just being afraid that somehow I was going to end up hurting him.
We do a great job of caring for our adult population, our hospice population, our palliative care population. But there's this whole other sector of the population, children, that we hadn't had a regular program for. 9 months ago, when I started in earnest to create a pediatric program, one of the first things that I did was to talk to pediatricians and specialists and folks at Eastern Maine Medical Center and kind of take the pulse of what was needed for families to be able to have that kind of support that takes them from the inpatient setting to the outpatient setting in a kind of teamwork sort of fashion.
Then you're in the hospital and you have an illness and you get bombarded with 5,000 doctors all coming at you with different things, new meds, new treatments. Then you go home and then you've got 5,000 different doctors you have to see outpatient, and you're trying to manage and juggle your daily life with the new issues that you've got to deal with, and we're their resource to help a patient succeed at home. Just being even that shoulder to cry on, or just you need to vent, let's try to troubleshoot. It's rewarding.
Just having Teresa coming in, checking everything and saying, everything's okay, he's doing great, you're doing great. It was a lifeline.